I am DR.CL Venkat Rao. Gallbladder stones. This occurs more commonly in women, can also occur in men. The gallbladder is a small reservoir situated below the liver, and it acts as a temporary reservoir for storage of bile. As and when we eat fatty food, the gallbladder empties the bile. Bile is useful for digestion of fat substances. The gallbladder stones occur because of two main reasons. One is obese people, stout people, they get yellow stones in the gallbladder, that is called cholesterol stones. It's more common in stout people and people who eat lot of sweets and who are diabetics. There is another type of stone that's called pigment stone. It can occur in thin people also because of those people who suffer earlier the typhoid disease. Typhoid leads to this pigment stone. The stone color is black. Cholesterol stone is yellow in color. These stones, it may remain silent. There may not be any symptoms. Whenever, for some other reason, ultrasonography of abdomen is done, then they may come out. Otherwise, these gallbladder stones can produce severe upper abdominal right-sided pain or pain just below the heart, severe pain. Sometimes the pain goes back to the back also. It radiates, it goes to the back. Along with the pain, there will be vomiting sensation or vomiting. Sometimes, along with the pain, there can be jaundice. The jaundice occurs when the stone in the gallbladder slips into the bile duct. So, this has to be tackled in a different way. The diagnosis of gallbladder stone is by ultrasonography. There is no point in doing an X-ray. X-ray does not show these stones. So when the stone is only located in gallbladder, the treatment is very simple. The gallbladder stone can be safely removed by keyhole surgery, laparoscopic surgery, robotic surgery, and it doesn't take much time and 100% success rate. There can be stone in the gallbladder, stone in the bile duct. When there is a stone in the bile duct, there is jaundice. The jaundice can be detected by urine examination or liver function test, blood test. The stone in the common bile duct has to be removed by ERCP, special procedure by passing an endoscope. After removing the stone through endoscopy, ERCP, the gallbladder can be removed by keyhole surgery or laparoscopic surgery. If there is a stone and we don't attend to it, what are the problems arising out of it? One, they keep getting pain very frequently. Not only pain, there will be intolerance to fat. There will be indigestion of the fat. The fatty foods, oily foods, they will not be able to digest properly. It can lead to jaundice. Sometimes the stone, they get disintegrated and sludge or sand-like particles may come down and they may produce damage to the pancreas. In the long run, if the gallbladder stone is left behind in the gallbladder, it can even produce cancer in the gallbladder. So, whenever somebody finds a gallbladder stone, it is better to be removed. And if the gallbladder is found in a diabetics, it has to be taken as a priority in managing, because the complications of gallbladder stones are more. Because of the stone, there can be accumulation of pus in the gallbladder. Hence, in diabetics, earlier the better keyhole surgery, laparoscopic surgery to be done to remove the stone. When we remove the stone, it is the stone along with the gallbladder is removed. There will not be any problems or difficulties by removal of the gallbladder along with the stone. The treatment is removing the stone along with the gallbladder only. Only stone cannot be done and it should not be done. If you leave behind the gallbladder, again the stones will reoccur.